Good afternoon, everyone. I'm Commissioner Zoe. I'm your Police, Fire and Crime Commissioner for North Yorkshire and York, and welcome to my public accountability meeting for North Yorkshire Police. So we'll go straight into the agenda. Agenda item 1, attendance and any apologies. We've only got one today, and that's from Tom from my office. Agenda item 2, minutes of the previous meeting. So just to note that the minutes from the previous meetings are recorded and published onto the OPFCC website, and there are no updates or actions from that. Agenda item 3, we have, unfortunately today, no questions from the public. Agenda item 4, we're going on to the presentation now, prevention and early intervention presentation and questions. So I'll hand over to Ed Hayward-Noble, please.
Thanks, Commissioner. It's nice to be back again at the public accountability meeting. We covered off antisocial behaviour last month, and talking about prevention and early intervention follows on really nicely from what we talked about last month. So I think it's a really good opportunity to probably build on some of what we talked about last time and develop that further. I'll go into the presentation. I'll just share that on the screen. Just to emphasise as well from what I said last month, it's very much a joint approach between the police and our partner agencies as well. It's prevention and intervention isn't something that we can deliver on our own. And to that end, I've got my colleague with me as well, Superintendent Rachel Wood, who leads the Early Action Together programme. So I'm Superintendent Ed Hayward-Noble. I'm head of North Yorkshire Police's Partnership Hub, and our remit covers various portfolios, including problem solving, schools liaison, mental health, part of the drug side of things, which we share with crime, the specials and volunteers and civilians who are involved in citizens in policing, etc., and the alcohol licensing as well. So if I can hand over to Rachel to introduce herself as well, please.
Good afternoon, everyone. I'm Rachel Wood. I'm the superintendent in charge of the business change team. So one of the key pieces of work of my team is around driving the Early Action Together programme, which is how we're going to drive that early intervention prevention vision and the strategy set by the chief. And the 4 projects within the Early Action Together programme, known as EAT, is how we're going to actually deliver that early intervention and prevention product.
Lovely, thanks, Rachel. Just moving on to what we're going to cover in the presentation this afternoon. So we'll start with some background and context, building on what Rachel's just said around the project, and then an overview of prevention and early intervention and early action together. We'll talk about some of our strengths then and what's going well. We're part of the way down the road to implementing prevention and early intervention, and so we'll be happy to talk around the good work that's going on already, and then we'll come on to some of the challenges that we've got, and specifically that's around some of the issues that we know that we've got to overcome to progress things further. So we'll talk about how we're going to do that as well. And then we'll finish up by talking about the specifics around what we plan to pursue in the next 12 months and beyond that as well, and also the results that we're hoping to see, so that we know things are on track and we're achieving what we want to achieve. So just some background and context to begin with. It's quite self-explanatory, really, this slide, but our ambition, and this is very much led by the chief, is to see prevention and early intervention truly embedded as a way of working right across the whole organisation. And the reason why we want to do this is because it will break cycles of repeat offending, which will reduce harm to our communities. So this is all about getting to the root of problems, understanding what's really going on, rather than dealing with what we're presented with, looking deeper into what's really going on under the surface, and then resolving those issues so that we're implementing long-term solutions to community problems. And the EAT programme, the Early Action Together programme, is what we're using to deliver that ambition. And it's about making sure that we're changing the organisation so that our teams are equipped with the necessary skills and training to be able to drive this work forward. And it's also about a mindset change as well. All our people are very much focused around solving problems for our communities. It's what everybody who joins a public service, including the police, wants to do to make things better for people. This is about changing our approach a little bit and doing a bit more work at the start to really understand problems before we start implementing solutions to them, so that we're getting long-term sustainable solutions in place. So it's a long-term program programme of change for the organisation, and it's about working together with partner agencies. And this is not something that the police can do on our own, and it relies heavily on collaborating closely with our partners who share the same objective as us of reducing harm to our communities. And some of the key relationships that we've got with the OPFCC, particularly with the team that Jenny leads around commission services and the diversionary schemes, which really support prevention and early intervention. Also with public health and the community safety hubs, which are part of the local authorities, mental health and schools, among others as well, that we work closely with. And it's all about, as I say, working together, identifying good practice, and then making those improvements jointly. So there's 4 key projects within the EAT project, within the EAT programme rather, which are focused on prevention and early intervention. They're all led by a superintendent with a team working with them. And the projects are focused on intelligence, pathways, customer contact and place-based working. So Rachel's going to talk through the first 3 because she's leading the programme, and then I'll talk through place-based working because I'm the superintendent that's leading that particular bit of it. I'll hand over to you, Rachel. Sorry.
Can I
please
just interject there and just ask you, can you please just explain the difference between prevention and early intervention for those that are watching, and also that prevention has 3 main levels, doesn't it? Primary, secondary and tertiary. And can you just explain the difference between them before we go any further for the public?
Of course. Yeah, no problem at all. So very good point. Thanks, Commissioner. So the difference between prevention and early intervention. Prevention is about preventing things from happening before they even do. Early intervention is having that acceptance that perhaps, sometimes things do go awry, but making sure that, as I touched on earlier, getting to the root of problems and dealing with them at an early stage when we wreck it. So it's about really making sure that our analytics, etc., are in the right place so that we're spotting problems when they're emerging, rather than them escalating, which then creates harm, on a increased harm to people. So prevention is about taking steps to do what we can to prevent harm happening in the first place. Early intervention is around when things, as I say, do go wrong, getting in there, getting to the root of problems and dealing with them at an early stage to prevent them escalating and causing further problems. In terms of prevention, yeah, as you rightly said, Commissioner, there's the primary, secondary and tertiary levels that we can go for that. Obviously, primary prevention is very much focused around things like target hardening, etc., and looking at what we can do to deter criminality to begin with in the first place. And then on the secondary and tertiary side, I'd say it's very much all around having the joint approach with partner agencies working right across together to make sure that we're not missing anything. It's a joined up approach right across public services to ensure that we're all doing all we can to prevent harm happening in the first place. Okay, I hope that answers your point there. Rachel, if I can hand to you then to take us through the intelligence bit and then the pathways and customer contacts, and just say to me when you'd like me to move the slide on, and I will do.
Be better if I was off mute. So the first project within the Early Action Together programme is intelligence. So intelligence runs through all aspects of police and informs key decision making in relation to criticality, threat, risk and harm. For true early intervention and prevention to take place, the intelligence and information really needs to be at the forefront. So the purpose of this project was to ensure that we can drive intelligence-led policing efficiently and effectively. And there's a number of aspects to this business case and what we're rolling out, but I'll just talk about the first one, which we actually launched yesterday. So we've got a new tasking and briefing system that's been delivered to all of our officers and staff across the force. And it's actually been really proud of this product. It's been designed in-house. So we've got together a group of over 50 operational staff and police officers that really informed some of the features of this new tasking and briefing system. What did they need to effectively and efficiently do their role? What did they need to get from that in order to serve the public and give the best quality of service? So we're really proud that it's been built in-house by our own ICT team, informed by our frontline staff. and that went live yesterday. So there are further phases to this business case with other things we're going to roll out in the future, but this is what we're working on right now. And so the benefits of this new system is that we're going to have a real-time priority-focused data, allowing resources to better focus on the needs of the individuals at the very earliest opportunity. So we're going to have improved capability and quality of briefings. So these officers are going to get the app for the first time on their phone. So when they're out and about on patrol, they're going to be able to access all of this up-to-date intelligence straight away without having to come back in. They're going to have the improved ability to resolve long-term community problems and accrediting accountability. So part of the tasking element of this new system that went live is around that accountability for people. And it's not just we've got this information, actually what our officers and staff do with this information, what actions have they taken, where is that recorded, who did it, where did it go to, and all of that stuff is really easily captured now on our new system. It will allow us to embed prevention and early intervention on a daily basis, and it will give us a really consistent level and quality of intelligence across the force. And we've invested in some new tasking intelligence officers to make sure that we've got that really accurate picture of our tasking, our intelligence. So I'm really excited about the launch of that. And what is wonderful is our team have been doing some face-to-face briefings with all of the frontline staff, and the feedback from them is really overwhelming in terms of how positive they are about the new system and how it's helpful for them in doing their role. But most importantly, it's about getting that early intervention, prevention and excellent service to the public. So we can let you know more about that in the future in terms of how that rolls out in the future cases. So any question on the intelligence project before I move on? Caroline?
Thanks, Rachel. I just wondered if you could bring to life, just as an example, for officer, just in terms of that improvement, the benefits, if you can, as a worked example, just to sort of highlight what the change would be and the information that would then be available for somebody working on the front line, just to sort of bring to life the benefits.
Yeah. So I think for me, it is all about the tasking element of it, because, we'd always share information. We'd always, as you would expect, have always briefed our staff at the start of their tour of duty. You would expect that. But this adds a whole new element where instead of it just being down to kind of professional judgment, shall we send that person off to go and do this welfare check, and each sort of individual supervisor making those judgment calls, the tasking element of it now will be really, right, okay, so we've got this intelligence and the system kind of makes them say, right, what are you going to do with this intelligence now? So who's going to go now check on the welfare of those children, put referrals in, what is the intelligence requirements? So we've got half a picture here, but this can be developed now. So let's test that through the system. We know which officer's being sent. It gives them a countdown. So it says, right, this is a high priority task. You've got 11 hours, 59 minutes and 30 seconds left to do this. It gives the officers a really up-to-date picture of timescales. It records exactly who's done what, where the referrals have gone. And it allows it to be really measurable in terms of, Business Insight will be able to give us a lot of performance data around how we're doing in terms of when you look at, the different inspections and things that the force might have in future. We're going to have some real qualitative data to present around what interventions and things we've done and how we've responded to the needs of the community.
That's great. Thank you.
Okay. Anything else on intelligence? No, we'll move on then to pathways then, please, Ed. So the Pathways project is about seeking out and identifying and making accessible the different available pathways into support services around the county for North Yorkshire for victims and offenders. So it's about enabling, support and encouraging the use of innovative alternatives to criminal justice routes, because that's what we want to avoid. It is all about stopping us getting to the point where we need to bring people to justice and stopping that from happening, both the offenders becoming offenders and victims becoming victims. It's about adopting an early intervention and prevention approach and exploring opportunities to reduce repeat victimisation, which is really important, and therefore improving the quality of life and the health of our communities. And it's about understanding our victims and supporting them at the earliest opportunity, tackling the root cause of the offending and changing the mindset of the organisation. So how that translates, that's the kind of vision. So how that translates is into a complete mapping of all the services that we've got available to our officers and staff and members of the public in North Yorkshire, which has also allowed us to do a gap analysis. So we've mapped out on the service directory all the commission services, through obviously the OFPCC, but also the statutory agencies, the third sector charities, loads of really great, rich information on a very, very simple app that our officers are going to have on their mobile phones, and also a desktop version for our FCR, our control room. And it's a really easy, instant thing for the officers. And just to bring it to life, Caroline, if this helps, what it will be is they'll go to a victim at 3 o'clock in the morning. They'll identify that the need perhaps isn't the police, it's more support services, maybe it's domestic abuse services, maybe it's homelessness, maybe it's drinking alcohol, whatever kind of issue you can think of. And all that officer or member of staff will have to do is press a simple button to say, where do I work? What's the issue? And instantly they will come up with an up-to-date directory that we have quality assured, so we know all the information is correct. We spent a lot of time making sure the information is correct. Links to the websites, telephone numbers, what the service can offer, where they are on mapping, how they access them. And with just one press of the button, that will email that victim all of the signposting information that they need. And we're going to roll that out to our control room as well, so that when our communications officers are dealing with callers that ring the police, perhaps a lot of the times that we're not the right service for them, they will very, very quickly be able to signpost them and get onto calls that they need to take for the police. So that will reduce call waiting times for them. We're actually going to roll this new process out. It hasn't launched yet, but in the next couple of weeks, we're going to roll it out as a pilot to the FCR in the first instance, so that they get that real benefits really quickly around helping with some of the demand pressures from the telephone. And then it's going to be rolled out to everybody in North Yorkshire Police. And the kind of vision from that is rolling it out to partners, fire and rescue, and really building on some of that internal stuff that we've got. So we've got a lot of really great information about that officers can access with who are our domestic abuse champions, what's the process for getting a domestic violence protection. So we've got lots of information on our source, and we're going to kind of build it into this app. And it's going to be a really improved ease of access for our officers. That is going to really quickly help that victim get to the right service. And we do anticipate it will result in an increase in referrals to our commission services, but I know they're all really keen to help as many people as possible. So that's a really positive thing. And again, it's something we've demonstrated at our neighbourhood conference to our neighbourhood officers. And it's something that the staff are really welcoming and saying that it's going to make their job easier. They're going to help the public more. And it's just going to be a really efficient and effective way. And we're going to keep on top of that. So we're going to make sure we've got a coordinator just recruited into the role who hasn't yet started because we haven't launched. But it's going to be their job to make sure that this information is current, it's up to date. If there's any feedback, any future bills we can put in. And it's another product that I'm proud to say that we've developed internally at North Yorkshire Police, that we've done it ourselves. And certainly when I've spoken to other forces, I'm not ashamed to say we're the envy of other forces because they don't have anything like this. You might think they do, but they don't. And, we're quite proud of what we've produced. And I think that's going to make a significant difference once we get it launched. So any questions on pathways?
Rachel, could I just come in just to give the Commissioner some assurance? Obviously, we've been working really closely with the team developing the pathways model so that the commission services, as Rachel said, are fully represented. But we've also been working on making sure that they're prioritised through the process as well, so that commission services, for example, for victims of crime, where we would advocate that supporting victims are the first point of call, they would come to the top of the list for officers seeking information. And the same for things like our diversion services as well, through Change Direction and Crossroads. They would come to the top of the list where it's appropriate for those to be the first point of call for officers looking for key information. So it's just to provide that reassurance as well that we've done that piece of work as this tool has been being developed.
Thank you, Jenny. That is a really important point. So yes, and thank you for all your team's support on that. It's been invaluable. Thank you. Okay, if there's no more questions on that, I'll move on to customer contact. Thank you. So obviously the Force Control Room and its wider function is the public gateway to contact the organisation, and it's absolutely key that we release capacity for the frontline officers to engage in early intervention and prevention. And this really is about the principle of getting it right first time at the initial point of contact. That's what we want to do. We want to be able to triage those calls and deal with them efficiently and effectively, and make sure that we've got the correct handling of calls, because that is our customers' very first experience of this system. So it's a really crucial project within the Early Action Together programme. So in terms of this, what we're hoping to provide is a tailored approach to our customers and across the county. We want to target and respond to crime, focusing on preventing harm and protecting the most vulnerable. And we really want to professionalise this. So we want to attract and retain a really highly trained, professional and diverse workforce. So how we're going to do this, and this launches on the 8th of June, so this isn't yet launched, but very, very close to launch date we are now, is we've created what's called an initial inquiry team. So they will replace our current Safer Neighbourhood Service Desk. So you might have heard that as being referred to as the SNSD. So the SNSD will cease and we'll have an initial inquiry team instead. And it's a redesigned appointment system, focusing more on remote resolution. Now, can I just stress this is for low level, low harm, low risk instances. We would not deal with things like domestic abuse or anything through this team. This is not about where there's risk or harm to a victim. These calls will be very carefully triaged as to what is appropriate to go to the initial inquiry team. So I just want to kind of reassure you around that.
Can I just come in there, if you don't mind? Can you just give us some examples of low level? You know,
well,
so the public understand.
Yeah, I mean, it could be anything from really minor antisocial behaviour. So we're going to be offering antisocial behaviour appointments. So that might be like children playing football in the street, or just really low level where it isn't high impact, because sometimes, and this is where your Thrive assessment comes in, Commissioner, because sometimes things can be low level but high impact. So we really carefully risk assess what comes in, because it is about, and a large part of that risk assessment is the victim vulnerable? Are they a repeat victim? What's the impact on the victim? So we do carefully assess. So I could give you some examples of very minor damage, you know, graffiti on a street sign, but in some contexts that could be really high harm. So it's difficult to kind of give you a full definition, but we're talking low value, low impact really, and low risk. So risk is really important. If there was a threat, this is why we would never have a domestic abuse incident dealt with by our initial inquiry team. You know, this is about being efficient. This is about providing a really good service where we can give a service level agreement to the public to say, you will get a contact and appointment within 3 days. You know, you will not be waiting 10 days for appointments. You will get to speak to somebody, and that person who's allocated to you will own that inquiry. And we'll get a really efficient and effective service, just very much in the way you might do when you ring your local doctors. So you ring your doctors and they decide, can you see the practice nurse or do you need to see a doctor? It's that kind of really efficient, you know, they'll get a text message with when their appointment slot's on. You know, it's for me, it's about the communication with people when they ring. So, you know, a lot of dissatisfaction is around people not being kept updated, not being informed, not being clear on what's happening with a case. And these highly trained officers that are going to have they're in the training now, so they're getting that kind of training now, is we're really investing in this workforce. And what it will do is it'll reduce wait times for the public that currently have to wait longer, because all of our immediate priority grades and our I&P grids will be still dealt with by frontline officers in person. So if something's the crime in action, something happening there and then, the threat risk, of course, they will get a police officer that comes to them in person and they will deal with it there and then. But this is about some of these slower grade jobs now where they don't get the service that we would hope to give them due to all sorts of reasons. So it's about standardising the equality of access to service. So whether you live in rural Craven, whether you're in York City Centre, these service level agreements will be equitable across the force, and you will get that service no matter whether you're rural or not. You know, which, you know, will improve efficiency. It's low harm, high volume stuff. It's going to improve the efficiency of investigations. So this unit now will do some investigation. And if we investigate this and there does, you know, we do identify a suspect, which is obviously what we would hope to do, then that will then go on to the response teams to bring that person in, to get them arrested, to get them dealt with. And it will just free up the capacity for response. So we anticipate that we'll be dealing with 21,500 incidents a year through the IET. And that's really going to take the pressure off our front line when they have to drive. You know, as we all know, North Yorkshire is such a big area geographically. If they're driving 2 hours to get to an appointment and 2 hours back, that's 4 hours out of the day. It's not efficient. So this customer contact remote resolution will be able to really quickly get to the heart of what the issue is and get done what needs to get done. And the public will see a massive improvement, and the front line will really feel some of that pressure being taken off them in the summer period. So any questions on customer contact? Launch is 8th of June. Go on, Caroline.
Thanks, Rachel. It was just to say, from obviously the business case going in from approval from an office perspective, have been fully involved in this from a customer contact point of view. And while it delivers on the Early Action Together programme, it obviously enhances the customer experience, which is very much, of course, delivery of the police and crime plan. And just to highlight as well for the Commissioner, after the launch, for Commissioner Zoe, she will be attending, allowing some of the processes to be embedded, but I believe that's factored in for the 20th of June to go and meet the team and to see how effective it is in place.
Thank you, Caroline. Any other questions on customer contact? Thanks, Ed.
Thanks, Rachel. I'll just talk a little bit about place-based working now, which is the fourth strand, if you like, of the EAT programme. And place-based working is all about basically recognising the unique nature of our local communities and then producing bespoke solutions, working with partners to achieve effective outcomes for them. So what does that actually mean? Well, it means collaborating with our partners, working really closely with them so that we can understand what's really going on. What are the issues, not that, as I said at the start, that we're presented with, but what's going on under the surface. And what's the best approach then? Taking an evidence-based, an evidence-led approach to understand what works to achieve sustainable long-term solutions to problems, because we know that then that reduces harm and reduces cycles of repeat calling to communities and to individuals as well. So, as I say, it's all about creating a bespoke system for each particular problem, and understanding what a place actually means and what it looks like. And that can be, there could be, for some issues, it could be county-wide. For other issues, it could be down to an individual local street or an individual premises. So we've got a flexible approach to defining what a place actually means, and then naturally following from that, the partners that would involve in addressing a particular problem will change depending on what it is that we're dealing with, the scale of the problem and the location as well, where it is. I outlined some of the key partners at the start who we're working with very closely on place-based working, but just to emphasise, it's all about identifying and tackling the root cause of problems. We're into the first phase of place-based working already, which involves delivery of problem-solving training using the SARA model to our teams across North Yorkshire Police. And then the second phase will be beginning later this year, which is around enhancing the problem-solving training. I'll come and talk about that a bit more in a little while, but also delivering jointly that training with partners. And the beauty of doing that is that then by having the co-production with partners of the training, everyone's got the same vision, everyone understands our own roles within the place-based working, and then we can all work together and complement each other in the approach. So it will deliver these, as I say, much better solutions and outcomes for our communities and individuals. And a big part of it is having effective engagement with our communities as well, and building resilience among our communities by engaging with them and by encouraging them to start finding their own solutions to problems, supported by the police and other partner agencies as well. But that's where where we'd like to get to in the future. We know that the evidence shows that co-location with partner agencies can support place-based working. That's something that we've seen very effectively at Scarborough and also at Craven. And so for certainly for some elements of it, we'll be looking to have greater co-location with partners, but obviously in the sort of virtual world as well, there are opportunities to work very closely with partners, particularly now we've got teams, etc., without actually being physically necessarily in the same building. It's just really cementing those working relationships that are already there, but just enhancing them and making them even stronger. So that's where we'll be going with place-based working. Moving on to the strengths bit, I'm just mindful of the time, so I won't dwell on any of these points for too long. So what works well at the moment? So the problem-solving approach to deliver prevention and early intervention. I've already talked about the training that's been delivered, and I'll come on to that in more detail towards the end about what we're trying to do in terms of changing colleagues' mindsets to a genuine problem-solving approach. Informing the workforce, we've developed a problem-solving dashboard. This gives all colleagues to easily and quickly identify repeat victims of crime, offenders and locations in their areas, and they can then identify the underlying information which allows them to effectively scan and analyse to get to the root cause of the issue. So I'll talk about the SARA model in more detail in a minute, but it helps with that scanning and analysis bit to understand what's really going on. The problem solving team, they are working to support officers, well, all colleagues in developing problem-solving plans which support prevention and early intervention, using national guidance and learning from other forces as well, so that we're implementing the most effective responses. So we're not reinventing the wheel. If we know that something works elsewhere in the country or elsewhere in the county, we're effectively sharing that rather than starting from scratch, which will mean that we can speed up the response to these issues. Partnerships is key to it. As I've emphasised, we've got North Yorkshire Police colleagues embedded within the community safety hubs, and that's a key part of the co-location bit that I talked about a minute ago, having those very, very close links with our partner agencies. And then some initiatives as well. We know that these are really, really effective in terms of diverting people away from criminality. So the Stepping Up project, Cops versus Kids, and then some of the commission services that Jenny touched on earlier, Changing Lives and Crossroads, are really effective in that, particularly around the early intervention part. And then Skills Liaison also supports early engagement in terms of when we've got these early signs that a child or young person may be being on the periphery of criminality, stepping in with partners again at an early stage to make sure that we're diverting them away from that and keeping them on the right path in the long term. Just a very quick case study. I've got quite a lot to say on this, but I'm just going to condense it down a bit because I'm just mindful of the time. But this is really to illustrate using the SARA model to take a problem-solving approach, supporting prevention and early intervention. And this was at Derwentthorpe in York, which is a new, relatively new housing estate with sustainable housing that's been built on the east side of York, Hull Road area. It was noted that there was a rise in calls from this area, and particularly around Derwentthorpe, and also concerns have been raised by residents with a local councillor around antisocial behaviour in particular. The concerns were very much around groups of young people who were causing the residents to feel quite uncomfortable, and one particular group who didn't actually live on the estate but lived close by to that. And you can see there the number on the map, the number of incidents that were reported. The blue markers relate to just one incident, but the green markers locate a cluster of calls. So you can see from the numbers there, sort of down on the Derwent Mews area, there were 7 calls to that area around the grassland, 6 on Derwent Way to the top, towards the top end there. So some real genuine, community concerns here, which is not what we want people to be experiencing in their lives. So, using the SARA model, which is scanning, analysis, response and assessment, we took an approach to solve this problem. So starting with the scanning phase. So information was gathered from our own systems to look at when the reports were happening, what time of day, which day of the week, so that we could actually pinpoint and highlight exactly when these issues are occurring. But we also did a survey of the local residents in partnership with the local council to really understand people's views, so we could get right to the root of the problem rather than just relying on what we were seeing on our own North Yorkshire Police systems. And the survey was done initially by email, but also followed up with visits to do that community engagement bit that I talked about a minute ago. And this gave us a real in-depth understanding of what's actually been reported, not just, as I say, what was being phoned into the control room. And you can see there it speaks for itself really, with on the numbers, particularly predominantly during the evening when we're getting the calls, and also around a Sunday and a Monday. which was quite surprising. Really, we would normally expect these type of calls to be on a weekend. So there was some work done to look into the reasons for that. So looking at the analysis phase then, moving on from scanning. So we use, for this bit, the problem-solving triangle with the offender on one side, the place on the other side, and the target and victim also featuring there as well, and the problem at the centre of it. And it's really around understanding what the underlying causes are. So what's going on, where it's happening, when, who's doing it, why they're doing it, and how they're doing it, and understanding the interaction between all those pieces, so that then we can come to the best solutions to address them. So from the scanning and analysis work that we did at Derwentthorpe, it was obvious that it wasn't just one or two people reporting antisocial behaviour. There were 26 different callers for the 32 incidents that had been reported. So there was a real, among residents, a perceived issue affecting a large group of them in a number of different locations. So this led us to the conclusion that there weren't repeat victims as such, although there were a number of people who called us twice. There was a possibility within that some of the there was a perception that perhaps the calls weren't getting the full attention that they deserved from the authorities, and that was perhaps encouraging people to call more because of the sense that perhaps the initial problem hadn't been dealt with. Again, another reason for getting in early and dealing with things at an early stage. When you look at the nature of the reports, this kind of backed up the initial finding that people were phoning in regularly to report that the gang were out and about, and that there was the potential for trouble rather than actual incidents themselves. But it's recognising that people were feeling unsafe, and then being able to do something about that. So we really understood what was going on, why people were calling us, what that motivation was for ringing the police, and also through the survey we could get their views as well around what they would wanted to see in terms of solutions to address this issue. So what worked? On the left hand side there, that just is a generic slide of options that shows what works or what can work nationwide to deal with antisocial behaviour, and it's things like, you can see there, prevention orientated policing, outdoor challenges, mentoring, hotspot policing, CCTV, etc. Moving down the list there, social skills training is one of them. The drinking age featured as well further down the list. But for this particular case in Derwentthorpe, there was a lot of work done to understand the individuals who were involved and to see if they were part of any other processes that were already underway. So we checked with, for example, with partners with the Children's Front Door Service, who were able to give us lots of information about the schools that these people went to and the type of support that they were accessing already. So then we could link in with the local schools to understand around any behaviour issues that were manifesting in school as well, and also put some interventions in within the schools in terms of acceptable behaviour, etc., and getting them to change their mindset and making them aware of the impacts of what was going on. There was also a piece of work with the victims to help them understand what constitutes antisocial behaviour and when to call the police, and doing a bit of myth busting as well about the nature and extent of the issue. And we could use the statistics to be able to do that, to give people reassurance that actually the extent of the problem wasn't quite as much as it felt, but recognising very much that was their feelings and how that was making them feel. But as I say, equally being able to reassure them with the numbers that the problem wasn't as bad as it felt. And we had some really positive feedback from that as well. So again, it was very specific to the victim, place and the subject. In terms of the locations, it was around, there was a particular site there, the Super Sustainable Centre on Derwentthorpe. There was actually Wi-Fi in that building, which was attracting people to it. So just by simply switching off the Wi-Fi after the hours of darkness, it meant that then that attraction had gone away. So that was a good example of getting to one of the root causes that was attracting people to that area. Also installing CCTV and lighting for an evening, and there was also consideration given to removing some of the seating areas. That was something that was discussed with the local communities there. There's a local play area that was attracting some people to it, understandably. Why wouldn't you? That's now been closed at 6 o'clock on an evening, which has also helped to reduce the attraction for people coming to that location. And then there was some work done with the perimeter fence as well around a Yorkshire Water compound, just to prevent easy access to it, and to make it less attractive to go in. And also by doing that preventative work with that site, it made it less attractive for the young people to access it by securing that site. And then there's a possibility here of creating a youth shelter, potentially with Wi-Fi and lighting. That's under consideration, in a nearby location, which is away from residents, but gives the young people then somewhere of their own to hang out. So that's giving a real positive solution as well, by giving them a purpose and somewhere that they own ownership of it, and somewhere for them to go and congregate away from Derwentthorpe. But the response to that has been, well perceived. I think I've had very, very positive feedback on the outcomes of that particular case study and the problem-solving approach. So it shows that using the SARA model, the road that we're going down, that it does work and it delivers these long-term sustainable solutions. So some of the challenges that we've got, first of all, is the mindset change for police and partners. As I talked about earlier, to join the police and to join other public services, people do that because we want to make a difference. And that's something that we've all got in common, to make a positive difference to individuals and communities, and the satisfaction in fixing things for people, and dealing with what we're presented with to fix the immediate issues. And that's our instinct. We used to go into an incident, fixing it and then coming away again, which is great in the short term, but it doesn't always deliver the longer term solutions. So the mindset change that we're talking about is by focusing more on the scanning and analysis phase of SARA, rather than just jumping straight to the response phase and fixing things straight away, getting to the root cause of problems, understand what's really going on. And that will be supported by the training. I'll come on to that in a second, that's been rolled out. Cultural change. This is a cultural change for us. We know that cultural change takes time to deliver. It's very closely linked to the mindset change. Decades of behavioural science research have showed that it can take a considerable amount of time to build cultural change, but that's not something that we're that's putting us off. We're not daunted by that. As I say, I'll come on to how we're going to approach that in shortly. But it's just acknowledging that it's not something that can happen overnight. Community confidence in public policing. This is important in terms of people's perceptions. I touched on it on the Derwentthorpe example. There will be still a role for enforcement. I've no doubt, the law is the law. People break the law, then, there are consequences of that. But there will be new approaches that will be coming in. And so there's a slight risk, or there's potentially a risk of some sections of the public thinking that we've potentially, gone soft on crime if we're taking some of these more innovative approaches rather than going straight down the enforcement route. There are some cases where, without going into huge amounts of detail, we'd go straight for enforcement without question. But particularly around some of the lower level crimes, or even antisocial behaviour that Rachel was talking about earlier, each will be assessed and so that we can understand the harm that they're causing, and that will inform the response. But in some cases, working with partners, it'll be a much more as I say, the approach will be much more around diversion, building on what we're already doing, diverting people away from crime, and then therefore implementing a longer term solution rather than them committing a crime, arrested, interviewed, charged, back out and do it again. And then what does success look like? Measuring success, not easy to do with prevention, because how do we measure something that hasn't happened? We know that for measuring prevention, traditional crime stats don't really work for that. It's something that police forces and other agencies are wrestling with nationally and across the world, really. And so if we can't measure what we've prevented, how do we know that it's working? And also, how do we give feedback and recognition to our communities, but also to our teams who are out there working hard. So that's another challenge that we've got, which we're working on, and I'll come on to that again in a second. So moving on to the opportunities, so that mindset change piece, this is going to be supported by problem solving training, and again, as I talked about, focusing on the scanning and analysis bit and really emphasising appealing to everyone's instincts that, yeah, we all joined the police to make a difference. You can make a difference in an even more effective way by taking that time to really understand the root cause of a problem and then addressing it, supported by the problem solving team. And there's some expectations, clear expectations, recognition of good performance in terms of using problem solving plans, and a real supportive approach, all supported by the problem solving team. The cultural change, this will need to start with the clarity of the principles which will be guiding what we're doing. So Rachel's outlined obviously the projects, and we've got this real clear vision of where we're going through the EAT project, which then helps with value creation. So everyone gets bought into the EAT project, understands the difference that it's going to make through corporate statements, etc. And then it really feeds into then, this is what our purpose is as an organisation, and what we're going to do. Drawing in stakeholders into that as well, it's really important that they're included, that our partners are involved in that cultural change piece as well, so that we've got those positive outcomes, building trust as well, and making sure that people are seeing the benefits of what they're doing and what the approach is achieving. The community confidence part, just aligning our resources to the EAT project, we believe in it. And we know it's going to make a difference, and that demonstrates in itself our commitment to prevention and early intervention. And that, I think, will give reassurance to our communities that we are trying to do the very best for them to prevent and reduce harm. And then taking these innovative approaches as well will help, I think, to build confidence in terms of the Stepping Up project, which I'll come on to, Cops versus Kids, and also building on the diversionary schemes, changing lives and crossroads that are already in place. And then effective communication as well will help us to build community confidence by highlighting the good work that's going on, which leads on to then measuring success and how do we talk about all the positive outcomes. So how we're going to do that? I mean, I think one measure will be a reduction, and what we'll expect to see is a reduction in the number of repeat victims calling us for help. As we get these long-term solutions in place, communities, I think, will start to feel safer. There is a possibility that the total number of reports that we get will increase. It's a bit counterintuitive, but actually, as we build trust and confidence further within our communities, it might encourage people to report who hadn't previously felt like reporting to us. So we might actually see an increase in the total number of incidents being reported to us, but I anticipate and expect that we'll see a reduction in the number of repeat callers. So that's something that we'll be monitoring. And the quality and quantity of problem-solving plans as well will be measured. We've got a new performance tool to do that. And that will also help us to have an overview at management level of what's going on in terms of problem solving across the force, what's working, and also where we need to focus our efforts more. So that's in place as well. And then there's going to be a framework that's being developed to measure the impact of prevention and early intervention from national best practice. Rachel, I know Claire from your team has been looking at that. I don't know if you wanted to say anything about it.
Yeah, just to say she's looking at various HMIC reports to see which forces have performed best around their measurements of intervention and early prevention, and she promises me a report in the next 2 weeks with some options of what we could put forward to adopt. So it's coming soon. So guess what I'm saying.
Can I just ask a question, Rachel? Is that going to? I'd be interested to know how often they measure. Will that be in the report as well?
Absolutely. She'll present a series of options and how it's done elsewhere and how they capture it and what they actually measure, and we can look at that to see if we want to adopt that in North Yorkshire as a formal framework.
Thank you.
Thanks very much. I'll move on just to a couple of quick cases. I'm really mindful of the time. Cops versus Kids. I talked about this one last time. This was from last year. It's around prevention, early intervention by effective engagement with young people who are on the periphery of crime or being reported missing or engaged in antisocial behaviour. It's all about building trusting relationships between them and the police and encouraging positive behaviours from them by engaging with them in a neutral environment and basically building trust and rapport with them through video games, which they invariably win. But then that also helps to build, I think, that rapport between them and the police. Moving on to stepping up.
Can I just mention as well, I know since last time we've talked about getting the Youth Commission and our Change Direction Service involved in some of those sessions moving forward, so that we can better link up with kind of interventions moving forward as well, haven't we? So that's kind of a really positive outcome of sharing information in relation to that.
Exactly. Thanks, Jenny. It's a really good point. I think just to illustrate that this is developing, and we're really focused on joining up at that strategic level and making sure that everything that we're providing it fits largely with what I was talking about around place-based working as well. We've got a range of interventions that we can offer, and we can make sure that we're targeting people with the right one that's going to work best. So yeah, thank you for that. That's great. The Stepping Up project, an innovative approach to prevention and intervention. This is engagement through sport. Just the diagram there illustrates the number of referrals that we've had, the largest number being at York, followed then by Scarborough, Harrogate, and then fewer in the more rural areas, but you'd expect that because of the population centres being where they are. The total number of referrals that's been made altogether as well, broken down there by gender, and what it does, it creates a sense of safety and security in the community among young people at risk of entering the criminal justice system by providing safe and nurturing environments at sports centres and schools. And they get mentored by professional sports people, which encourages positive behaviour. It's really targeted at young people who are experiencing a chaotic environment or living through a traumatic experience, and so are at risk that way. And it's includes ourselves and the local authority, education, and the third sector as well. And some businesses have been invited to join into that one too. It's rigorously evaluated as well through a baseline assessment of key indicators relating to young people's health, attainment and interaction with the criminal justice system. So these are the measures that we use with Stepping Up to measure the success of the project against a trend of identified indicators, so we can really understand how much of an impact the project is having on preventing young people from entering the world of crime. And I'm pleased to say that it has proved to be effective in doing that. So again, that's a further measure that we can use for our preventative activity. Just a couple of quick case studies. Just one from Stepping Up was a 9-year-old pupil who was at the risk of criminality and vulnerable to exploitation. Risk-taking and disruptive behaviour led to him being excluded from school. He was assigned a mentor, and engagement through sport changed his behaviours. Having been excluded from school, he's now back into mainstream education and has been successfully diverted away from those criminal behaviours. He's really managed to turn himself around with that support rather than going down a more criminal route. Operation Choice. This is around young people found in possession of drugs, perhaps going, the early stages of going down that route. So again, getting in early with them before the habit becomes more established, working closely with partners in education and health for that. This individual was referred into North Yorkshire Rise, where they had several sessions. That was in October 21 when they were referred in, and by January 22 they were drug free and are now receiving continued support through their college to provide mental health support in the long term. And then the schools one is all around a 10-year-old who was referred into the school's liaison team after displaying threatening and violent behaviour in school and at home, and also going missing from home. They were lying, refusing to accept responsibility for their actions and any advice and direction. So an acceptable behaviour contract was agreed for home and school, including 4 sessions in relation to Optivan, crime and consequences, antisocial behaviour, the impact on others, to help them really understand what was going on and to change their behaviour. And the school reported back that since then no other major incidents had occurred, and the individual's general behaviour and demeanour had shifted towards more self-control and thought before action, and he was starting to develop self-esteem as well, which was good because it meant that then he felt more of a sense of self-worth, etc. And so some good feedback again that this approach had worked. There's many more examples that I could give from these projects, also from the other ones from the diversionary schemes as well. But I think that's all we've got time for now. So just pretty much the last slide. So our aims and results in the next 12 months and beyond. It's to continue with the alignment of our resources, as we've talked about, towards implementation of the 4 EAT projects supporting the prevention and early intervention strategy. Delivery of the next round of problem solving training. As I said, this is a joint approach with partners, resulting in long-term sustainable solutions to problems, and also that really important mindset change, focusing on the scanning and analysis part rather than just jumping into the response phase. Continue with the cultural change that we need to deliver true prevention and early intervention, again recognising people's value set and what we all join the organisation to do, and then really appealing to that. And then in terms of the innovations that we're looking to, Cops versus Kids, stepping up other innovative approaches and really building on those strong foundations and those partner relationships that we've got and the other diversionary schemes to get upstream and divert people away from the criminal justice system before we get into cycles of criminality, which then obviously has a negative impact on other people. And then continue to develop the measures of prevention early intervention so that we can understand what's working, what's not working, and tweak it if we need to, and also so we can give feedback to our communities and to our colleagues as well, recognising and sharing best practice. So that is pretty much the end of the presentation there. I'll stop sharing. Was there any questions, please, from anybody? In that case, thanks very much for your time, and thanks for listening.
I'd just like to say thank you very much to Ed and Rachel. It was very informative, very good piece of work there. Thank you. And I'm sure we'll get you back to see how it's going in the future. So thanks for that. Okay, so going on to agenda item 5, and that's performance update and any questions, handing over to Elliot.
And good afternoon, Commissioner. Good afternoon, everybody. I hope you can all see the screen there. Thank you. And I'm indebted actually to Caroline for the feedback and working with me on this. I really appreciate her hard work. So the slides today, the first 2 are on the force control room. And I know there's going to be a little bit more of a spotlight on that. So I'm going to hand over to my colleague in the best traditions of the service and pass it on to Lindsay.
Thank you, Elliot. Afternoon, Commissioner. Hello, colleagues. So the first slide shows our 999 call handling performance. The average speed of answer, the trend, the blue line, shows the period between the 1st of May 2019 through to the 30th of April 2022. Some key points that are summarised just below that chart. So compared to last month, we are seeing a 5% decrease in the number of 999s that we are receiving, but it is still significantly increased on the call volume that we received last year. So when we compare that to April 2021, we're 26% increase in terms of the number of calls that are presented to us. The table at the bottom of that slide shows our call volumes and also our average speed of answer. So just to highlight, the nationally agreed service level agreement is that we will answer 90% of our 999 calls within 10 seconds. So you will see there our average speed of answer is still sitting at 19 seconds. Commissioner, there are a couple of points I'd like to make on this if I can. Firstly, to summarise the work that's been ongoing through the internal Gold group. So for the public's information, that is a group that's currently chaired by myself, brings together key leaders across the organisation, and we look at how we can work together to bring that time down to within the target 10 seconds. At the moment, we know we are not where we need to be. We are working really hard in the background to increase our recruitment, to get us to our establishment, to make sure that we've got more people available to take calls, which will ultimately have a positive impact on the speed at which we can answer them. That means that currently we are using what we're calling a reserve staff scheme. So this is officers and staff that haven't previously worked within the control room environment, who are coming in to support to undertake some of the administrative functions so that our call handlers are free and available to focus on incoming calls. So it's very early days in terms of that scheme being in place. It does involve a small amount of training for those staff. However, we are seeing some positive results. So when we look at our average speed of answer since that scheme has been in place, we are looking at 56% of our calls being answered within that target of 10 seconds, which is an increase from 43%, which is where we were before those additional staff were put in there. So in terms of our recruitment, we have a course ongoing at the moment. They are nearly finished their training and will then be working in the room, being able to make a really positive difference. We have our next intake scheduled for June, and we are looking to be at our establishment by September. So there's a lot of work going on in the background to get us where we need to be in terms of improving our current call handling performance. Nationally, colleagues may be aware that we are due to have 999 league tables published. They will be available on the police.uk website under the 999 tab, and that will report the total number of calls to the force each month, the mean waiting time, the percentage of calls that are answered under 10 seconds, and then also between 10 and 60 seconds and calls answered after 60 seconds. So that information will be in the public domain from the 31st of May. So I think, Commissioner, the proposal is that we bring that information into this meeting in June as well, and we talk about the figures that are presented nationally through the BT data, and also how that aligns with the reporting internally through our own systems. So happy to take any questions on 999.
Thank you. I've got a couple of questions for you. So I think it's really important that the public who's watching today understands actually about all the hard work that's going on behind the scenes. So I wonder, could you just explain when the gold groups started, who sits on them and how often they meet? And then it's very difficult, but at the moment, a brief timeline to when are we expecting to be able to answer these 999s, within the 10 seconds, Lindsay?
Thank you, Commissioner. So in terms of the Gold Group, we've been in operation since March of this year. We have, as you would expect, management from the Force Control Room, but we're also working with our Business Insight colleagues. So that's the team within North Yorkshire Police that support the collection of data and insight in terms of our systems and information. We're working with our colleagues from People Services who support in terms of recruitment, and also with finance colleagues as well. And linking in really, really closely with staff associations and also corporate communications in terms of being able to give key messages to the public, and also to be able to present and updates across internally and externally. In terms of when will we see our call handling under 10 seconds, clearly the recruitment that is ongoing will have a positive impact. So the course that are currently training will be live in the room in a couple of weeks. So we're hoping that will have a positive impact. And again, our course that comes into the organisation starts in June, should help us in the beginning of August, again, to have a positive impact in terms of the number of calls that we can answer within that target of 10 seconds. But that is absolutely our focus at the moment in terms of enabling our call handlers solely to focus on those incoming calls and being available to take those calls as quickly as possible.
Can I ask a further question about, so we see on the screen there 5% decrease in calls compared to March, the previous month. 5%, would you anticipated it to be more than that, or is that fairly where you see it at? And how do you think it's going to go for the next month? Although it's really hard to tell, and I know it is. This is a bit unfair of me because your calls that come into the centre, they fluctuate, and there's no doubt about it. You really are experiencing an increase in calls, definitely. But I want to put you slightly on the spot there, Lindsay.
No, that's absolutely fine. It's really difficult to answer. What I will say is that in April of this year, when we reviewed the last 3 months call volumes, we were 2,000 additional 999 calls per month compared to where we would expect to be for this time of the year. There's a lot of work ongoing nationally to look into that, to understand exactly why that's happening. And it's also really important that we ensure that what we're counting through our systems and processes that are in place align with the data that's being produced by BT. to make sure that actually we're reporting on the same thing. So we know that those tables will be published on the 31st of May. There's a lot of work going on internally to make sure that we understand how that data is captured and exactly what's being reported, and to make sure that our systems and processes align with that, so we've got a single point of truth that we're able to report back to the public on.
Thank you. Caroline.
Thank you, Commissioner. Attending Force Control Room Gold as I do, and obviously seeing and hearing some of the work, I just wondered if it's worth taking the opportunity about the extraordinary funding, and just talking about that being an investment, obviously, to help with the improvements, and just that reassurance that the money is being spent, it's on track, it's obviously helping with the resourcing plans that you have.
Absolutely, thank you, Caroline. So really grateful, Commissioner, to yourself and to your office for the support of the additional funding. In April of this year, we drew down the £70,000 that was agreed last year to support the control room. That's been used to pay for overtime for the staff reserve scheme that I've talked about, which gives us the ability to bring people in and to perform some of the admin tasks that our call takers would ordinarily be asked to do, as well as taking incoming calls. So that could be responding to emails, it could be processing online reports. We've got other officers and staff now from across the organisation supporting in those particular roles, which allows our call handlers solely to focus on taking those incoming calls. And I believe that's in place now until the end of July. So yeah, really grateful for your support on that one. Okay, thanks, Elliot. I think that takes us on to 101. So this slide shows the average speed of answer for the period, again, the 1st of May 2019 through to the 30th of April this year. We have seen a decrease in calls this year and also year on year in relation to 101. Again, that's in line with the national trend. That may be because we now have some online reporting mechanisms, but again, we need to understand exactly why that's the case. Again, you'll see our call volumes presented in the table at the bottom of that particular slide. So the average speed of answer is against a nationally agreed target, again, of 2 minutes. So we are 6 minutes and 3 seconds average speed of answer for 101. Again, that is significantly over where we would want it to be. As I've outlined already, our focus at the moment is absolutely on our 999 call handling performance, because they are our emergency calls. So clearly that's where we want to focus our attention. But what we are seeing is that the additional resourcing into the force control room is also having a positive impact on our abilities to answer 101 as well. So at the moment, we will focus on the emergency calls and making sure that we can answer those within our target time. But obviously that additional resource is giving us some additional capacity, which means we're also seeing a positive impact on 101. I think, Commissioner, there's some opportunities to promote through this forum the use of single online home and the ability to report online, which is available through our website. And also, I know we've got some communications that are being drafted at the moment to highlight and promote some of the inappropriate use of 999 and 101 as well. And we'd really ask the public to work with us on that in terms of making sure that the calls we're receiving are genuine emergencies and really appropriate for to be using that particular network.
Lindsay, I just wonder if you could expand a little bit on the data that we're collecting of the calls that are made for, especially for 101. So we've been really focused at trying to understand, you know, why the public are ringing 101 and for what reasons, and if they're ringing the right number, frankly. So I wonder if you could just expand a little bit on that.
Yes, of course. So this is an area that we focused on through the Gold Group, making sure that we are promoting key details for partner agencies, because we know that we do receive some calls for service that actually would be more appropriate to go to local authority, for example, or perhaps individuals who need help and support, as Rachel and Ed have outlined in their presentation. So there are a number of pieces of work that we're looking at the moment to understand exactly why people are ringing us, to understand where that additional demand is coming from, but also to get the Pathways app that we've talked about in the previous presentation onto all of the desktop computers in the control room, so that our call handlers are able to really quickly identify the help and support that might be available, and to signpost members of the public to the correct agency. So there's a piece of work ongoing to understand the data and where that demand is, and perhaps where calls need to be redirected to, but also making sure that we're able to help people when they do make that telephone call, and we know what's available in that locality and we can signpost them quickly.
Thanks very much, Lindsay. That gives us a really good in-depth briefing about what's going on behind the scenes. And, you know, it's been going on since the beginning of March as well, that you're really aware of this. So thank you very much.
Thank you, Commissioner. And Caroline?
I just wanted to take the opportunity just to advertise, obviously nationally, for commissioners and police chiefs. They're obviously wanting to gather feedback on customer contacts, and there is a survey that's out at the moment which continues for quite a few weeks now. All the information is available on our website, and it's seeking views on customer contact, specifically around 999 and 101. So I just didn't want to miss the opportunity to advertise that if people wanted to feed their views on the service. Obviously that comes back to us as North Yorkshire, so we'll be able to see the service that's provided and helps enhance the service moving forwards as well. Thank you.
Thanks, Caroline.
Okay.
That takes us back to Elliot. Thank you.
Thanks, Lindsay. Thank you very much for doing that for me as well. So I'm just gonna. I am conscious of the time, so I will focus on the main important points. This is our response times. The thing to note here is if you look at the immediate, which is our emergency calls, emergency responses, both urban and rural, you will see that with a bit of fluctuation, they are fairly static. The priority times have gone up slightly. But this is 3 years worth of data, or 2 years worth of data, sorry. So you would expect that we're looking back at some of the COVID times there as well. There's nothing really by exception on this slide, other than just to say, as usual, we've seen that although we deploy more resources to public safety and welfare, what we do is we are spending far more hours and far more time on the crime-related incidents. So unless there's any other questions. Okay, so our crime levels, you can see, are pretty good. They still remain static, in fact, a slight decrease. And the previous PAM, it's not on here, but on the previous PAM, I said, the accountability meeting, I said I would look into what appeared to be some rises in sexual crimes, if you remember, during the summer period, and the hypothesis that that might be caused by tourism. So I commissioned a piece of analytical work around that. And the analysis has shown actually there's absolutely no correlation at all between out-of-force victims or suspects on that, which is it's a really good piece of work, and it will help us form our plans going forward in relation to dealing with sexual offences. A couple of bits of note: 96% of the suspects were male. And alcohol featured in just over 24% of the cases. So that's the main exception from this particular slide. Is there any points anyone wants to make on that one? Okay.
Elliot, can I just add, just following on from some of our conversation earlier about where we sit, so looking at North Yorkshire in terms of the comparison from previous years and where we'd sit perhaps with our more similar forces, putting into context, yes. Of course, that was just a point I wanted to highlight and ask if there's any plans and opportunities we've got within PAM to sort of present that.
Yeah, actually, it forms. You've just kind of read my mind, because it forms part of this next bit. In all fairness, what you can see from these slides here are that it's 3 years worth of data, and I think it was really important for us to set that context, because to set it against last year or the year before would not show a fair representation. But actually what I've asked for going forward is a 12-month data, and where at all possible, where we can show that using iQuanta data and other data, which will show us in comparison to our similar forces or other forces nationally. Now, it's not always easy to do, and it's not always current, so we do want to make sure we've got the caveats around it, but I will work with you to try and get that done as well. So you can see, I'm just coming on to the national, what we call, I guess, neighbourhood crime now. You're looking at what we would call that tradition. Sorry, Commissioner.
I'm really
yes.
sorry, Elliot, to stop you mid-flow.
No, it's fine.
Going on your previous slide,
yes.
It's great information, but I think for next time, the information could be broken down by area, crime by crime, because although it's giving the stats for like York, Scarborough, Harrogate, it's not actually breaking it down. So I think for next time, that would be really good if you could do that for us. Thank you. I
will get that done for next time for you, Commissioner. No problem at all. So just coming on to burglary, as I say, neighbourhood crime is going to feature heavily for us, I think, in the next force performance meeting as well. And as I've said, we will show this as 12 months going forward. So we do know our burglary figures, as you can see from this, remain low overall, and compared to 2019, you can see by way of illustration, actually, in 2019, we had 2,384 residential burglaries. That figure is down by over 45%. And in real terms, that means there's actually nearly 1,100 fewer victims of burglary than there was in 2019, which is amazing, and I think the public would be rightly pleased with that. Our job, obviously, is to suppress that and keep that down even further where we can. Our current burglary resolution rate, you can see over the 3-year period, sorry, is 4.47%, with around about 126 days to investigate that on average. I would prefer a shorter investigation time, but our current resolution rate is not where we want it to be. For the past 12 months, it's sitting at around about 2.8% today as we look at it. So we will be picking up on that, and I'm happy to bring that back to a PAM in the future to look at what we're doing with it. And I'll just come on to the bottom one before I throw it open to any questions on this slide. Robbery, again, from the last PAM, you will remember we saw what we thought was an increase in a couple of bits there that were concerning. So I asked for a problem profile to be commissioned, which has been done, which has given us a real insight. There have been 290 offences of robbery reported in realistically just over the past 12 months, with a peak, as you can see, in June there, which was all down to what we would call personal robbery, so robbery of the person rather than a business. And I've asked for a bit of work to be done to find out exactly what caused that, and to make sure we don't have a repeat of that at some point in the future as we come into June this year. We're showing a declining trend in robbery, and certainly in relation to our business robbery, they remain really low, really static. And it is really important to point out that although there have been 295 offences of robbery, that's actually really low numbers. Everyone's a victim, I absolutely understand that, but they're quite low numbers. The current robbery resolution rate is shown there for the 3-year period, 8.58%, but at the moment that's sitting at around about 3.94%, so that's quite low. And again, that's something that I'll be picking up through crime. And that's those two. Are there any questions on the burglary and robbery? No. I will move on to violent crime. It's fairly stable. Obviously, you can see the rise where we came out of lockdown and people started going out and about again. But I'm content that that remains pretty stable at the moment with the overall resolution rate as it is. It was about 23% of violent crimes actually currently awaiting an outcome to be assigned, which is something that we are conscious of. Vehicle crime at the bottom then remain well down on pre-COVID levels, but there has been a recent increase. It's something we're looking at more closely. It's still within what I would call our control limits at the moment, but we will ensure that we do keep an eye on that. If it starts to go up, we'll obviously take action. And that's it in relation to those bits. The only other thing, Commissioner, from last time is I said we would look at the making off without payment, people, the theft of fuel from filling stations, which had gone from 9 to 49, if you remember. And I said I wasn't sure if there was a trend in that, given the sustained increase in fuel prices. It has actually reduced a bit. We've got no trends. We've got one repeat location, which I've asked to have a bit of target hardening and a bit of crime prevention advice with that particular filling station. And that's it for the neighbourhood crime. So the crime investigation outcomes, again, I think this is a slide we've seen several times. The main thing I wanted to draw your attention to, Commissioner, and to everybody, was that figure there, the 42.15% grouped under awaiting outcomes relate to other incidents and non-crimes. So we've got a big chunk of stuff sitting there which says awaiting outcome, which are around about 10,000 of them actually, which actually doesn't relate to any crime whatsoever. So I've asked and tasked that the data is cleansed for that, so that by the time we come back next time, it shows a much more accurate reflection, and we're not looking at non-crimes, as it were, that are awaiting outcome.
Yeah, so can I just further ask you about that? Can you just give us an example of other incidents or non-crime? Because I have to say, I did look at this slide, and I thought that is, that's far too many waiting. So I think it's really helpful for the public that are watching to understand what they are and why that is. Drill down a bit more, Elliot, please.
If I give you an example, it's bound to be the wrong one, Commissioner. So what I will do is I'll try my best to explain it, and maybe one of my colleagues will dive in if they need to. This would be something that's reported to us from the public, that actually doesn't get recorded on our system as a crime, but it's an incident that has had a response, and we've looked at it and said, actually, this is now not a crime, or it's another form of incident. And I'm loath to give an example because it's bound to be somebody leaping in telling me that actually that is a crime. But it's one of those things that it can just add white noise to what we're trying to look at. So these are just generally very low level things that don't require us to record it and investigate it in the way that we would a normal crime. I tell you what I will do. I will bring back an example for you next time, Commissioner, as well.
But I suppose that in itself is, why is there been such an increase in those? Just because they're so low, if you look back to, say, 2019, they're just so low, and then there's such an increase. So maybe some further work to be done on that. And I'd really like to understand what you mean by cleansing. You talk cleansing this. What does that mean?
So if you look back to 2019, you see a fairly consistent chunk at the top there of around 300 or so, and that for me will probably take up the bulk of what we're calling those non-crime incidents on there. So that's probably consistent. As it gets broader, that is now incorporating a lot more of the crime elements to the right of the scale, and that's why that looks bigger. So crimes that are still actively being investigated, and that's why it does. So cleansing, that will be actually just to be honest with you, our ability to discriminate between the non-crimes and the crimes, and then just remove them from what we're presenting on here, so you can see pure crime rather than stuff that we wouldn't investigate anyway. So it gives you a much better picture. Does that make sense?
It does. I want to bring in Mabs because he's got his hand up there.
Yeah, thank you, Commissioner. Just to come in support of Elliot and help out a little bit. So there's a piece of wider work. Elliot, you were doing a fantastic job, much better than I would have done in trying to explain that. Just in relation to the application of outcomes, obviously there's a whole range of outcomes that under the Home Office counting rules that we can apply against crimes. So all of these up within what we call our crime recording occurrence management unit, CROMU. So there's a piece of work ongoing. We accept and recognise there is a bit of a backlog in there. That's as a result of the amount of sort of crimes that were coming through, but also some staffing shortages within that team. We've bolstered that team on a temporary basis. We're looking at longer term recruitment, and there's a piece of work to be done to prioritise in applying the outcomes where we can claim credit for the work that's been done in relation to a positive outcome. And that's going to take place hopefully by the end of June, certainly for all the crimes that have taken place, and that we can claim a positive outcome, which is a charge, caution or similar, by looking at the period from 1st of April to the 31st of March, which is our performance year. So we have until the end of June to be able to claim that with the Home Office and to get credit for all the fantastic work our officers and staff do. So that's the first part of the work. The further work that's been done is to make sure the recruitment matches the demand, which is taking place. And then we would be much more on an even keel, and then you will see them numbers reducing as time goes on. But that shouldn't be a long period of time now, because we have got the plans in place.
So just going to push you a little bit further on that one, Babs. So, when you refer to that's not going to be a long period of time scale to that?
Well, the first part of priority work, not to put Lindsay or other colleagues on the spot, is looking at claiming the outcomes that we can between the period I've just outlined there, which is the 1st of April 2021 to 31st of March 2022. So that's the priority piece of work. The next, and as part of that, what we always do is prioritise any crimes or incidents which relate to vulnerability, such as rape, stalking, harassment, domestic abuse. The recruitment plan, I think, takes us up to September. So once them staff are in place, clearly there's a lot of work. We've also applied lots of overtime on this at this moment in time, but we recognise that's a bit of a sticking plaster approach, and that's not what we want to do, because it's not good for the staff that are undertaking the work on the extra hours that they are working already. So what we need to do, the longer term approach, is get the staffing in place. That hopefully, Lindsay, if I'm right, is September, isn't it? By the time the staffing will be in place. And then, yes, there'll be some catching up to do, but they'll be in a much more stable position. Then we can start looking at how we cleanse, as Elliot describes it. It's a very policing type of word that we use in terms of cleansing the data. That's all that means, is we're just trying to do some housekeeping to make sure our records are accurate and reflective of the work we're doing.
Thank you. I think I prefer housekeeping. Thank you very much. Thanks.
Thank you. So the next slide is the section 136 slide on the mental health detentions. So just just to reiterate, custody has not been used as a place of safety for any individual for over the past 12 months. Actually, again, we've seen a slightly higher than average incident levels. Nothing by exception really to report. The one thing I did want to draw your attention to is, again, last time I said I'd look at the top right there, the average minutes per occurrence, because it comes to about 12 hours. That is actually the time the incident is created to the time the last officer clears from an incident, and the bulk of that time is spent at a place of safety waiting for a mental health assessment. So it means our officers do get tied up waiting for that, and that's really the bulk of the time. So that's really it for this slide, Commissioner.
I've just got one question on this one. So you're saying that here 6 incidents require police transportation. Now, as we know, the back of a police van or in a police vehicle is not the right place for somebody who's suffering with a crisis, mental health crisis. So I just wondered, it may be putting you on the spot and you may need to come back to me with that further information, but why that happened and our health colleagues couldn't assist.
You're right. I will have to come back to you on it. I will look at it. It isn't what we would want to do. We don't want to be putting people in backs of vans and police cars when they're suffering a mental health crisis. There are times, and I suspect this may be the case, where people are potentially particularly difficult, aggressive, and it's for us to assist, and that's possibly what's happened here, but I'll come back to you personally on what that is.
Lovely. Thanks, Elliot.
No problem. So the next slide is on use of force. Now, one of the things I did query is that the previous month we've had our stop and search data on here, which isn't on this time, and I was told it rotates. What I've asked for is going forward that our stop search data is here monthly, because it's a really important part of our response of what we're trying to achieve. So I apologise it's not on here this time round, but I will make sure it is back for next time. This particular one here, I think the main bit to point out, the age profile, is probably exactly what you'd expect. That 18 to 34-year-olds are most often the people subject to what we call a use of force. Now, every force cross country, every officer, when they use force, has to submit a form detailing what they did, and this can be from handcuffing to taser to firearms, etc. So we record all of that. This is going to be coming to a new meeting that's being set up by North Yorkshire Police, called our Use of Powers Board, which will give a really good scrutiny of all of our kind of coercive police powers, for want of a better term. As you probably know, no surprises, alcohol is a factor in over a quarter of those. The next one I was going to draw your attention to is taser. So this is over 3 years, 805 records of taser use. You can see from the left-hand side, it's not that it's never used between 11 and 17-year-olds, but it's really, really low, and that they're subject to real scrutiny. Each use of taser is. But what I wanted to draw your attention to as well is that this age group here, the 18 to 34-year-olds, that comprises 58% of our taser usage, with the majority of these 246 defined as what we call red dot, where taser's not actually discharged, it's not actually fired as such, and what you get is a red dot and then somebody complies. It was actually only fired 57 times in that. And then the next age group is the 35 to 49-year-old. So it is actually really subject to strenuous reviews, and I'm fairly comfortable with the figures that we've got here. Are there any questions around taser? Okay. Moving on then to workforce. I'll start off with PCSOs. Recruitment plans are in place to increase that PCSO full-time equivalent workforce, and the plans should see us exceed our target of 229 by January. However, there is our predicted attrition rate, which could take us to 1 or 2 below that. So at the moment, there's a PCSO transferee intake, which we're currently considering, and that would help us to achieve those numbers a little more quickly than we currently project, and hopefully with that retention as well. I'll come on to the police officers one on the next slide in a moment. The police staff volunteers, at the last PAM Commissioner, I said I'd look into why we seem to have lost about 10 volunteers, and basically the coordination manager is auditing all of those volunteers that have been inactive and contacting them to see if they want to continue, and that's just led to some people dropping off, but that's going to be kind of refreshed as we go through it as well. Down to the bottom then, and the ethnicity data, workforce ethnicity. As you can see there, 2.11% is the current figure I have for our Black, Asian and mixed ethnicity or officers and staff, and it's not great. It's not where we want to be. We know that, and at the moment, there's a new governance structure, I should say, been put in place by the DEP, who's now running this as a kind of a gold, with me as the delivery arm as silver, to make some significant changes to how we're looking at diversity, equality and inclusion across the board as well. You'll know that the MPCC has just published its race and action plan, and the chief, who's online today, has confirmed that obviously we're fully supportive of this, and this will feature heavily in our approach going forward as well. And I think this would be probably something to be worth a spotlight on at some point in the future, once this is started to embed, so we can show what we're doing around our plans with this, and I'd be more than happy to bring that back. And then over on the right hand side there, you can see the gender difference. So you know, overall the figures are great, around about 46% women, but as you can see, as we go forward, there's a much lower proportion of police officers and higher proportion of police staff, with a good kind of mixture at PCSO. So not where we want to be with any of those figures by any means, and I'll pause there if anybody wants to ask questions.
Elliot, can I just ask about, as you did mention, there is a decrease in volunteers. Does that include special constables as well? Because I think there's a decrease from last month too. You know, the explanation.
Yeah, okay. No, I haven't seen that. I'll pick that up, Commissioner, and have a look at that. I have spoken to the lead for the specials very recently, and looking at the ambitious kind of recruitment that needs to go on with that, and I'm fully supportive of it, but I'll bring that back to you as well separately.
Thank you. Lisa, can I bring you in?
Thank you, Commissioner, and be remiss of me not to speak on this subject, being the national lead for citizens in policing. So in North Yorkshire, we have actually seen quite a high conversion rate of special constables into our regular officers for the Uplift programme. So that obviously causes then people who are joining as special constables, we are gaining massively. It's a positive thing because we're retaining those skills in the organisation from being a volunteer, where we've trained people and brought them into the organisation as a volunteer to then remain with us in the regular service, which is really good. And North Yorkshire Police has a really good conversion rate nationally on that, I think in the 46% off the top of my head. But of course, we do want to maintain our volunteer workforce and our special constabulary, and there are plans to increase recruitment of special constables on the back of understanding that the Uplift police recruitment programme would attract people from those volunteering roles into policing. So that is on the list in terms of recruiting back into the special constabulary as a result of people joining the regular service.
Thanks, Chief. And yeah, as I say, actually, this is joining the specials is not just about joining and to come into the police. We do want to attract a really diverse mix of people into the specials, people who want to be doing it on a volunteer basis.
Sorry, Elliot, can I just bring John in? He's got his hand up.
Yeah.
Thank you. It's a very, very quick one. Just for Elliot, really, I've sent you an email that you'll need to probably have a quick look at. If we can have a chat later on, it might clarify my situation regarding PCSOs. Thank you.
Okay, thank you.
No problem, John. Not a problem at all. Will do. And then this slide here is the police officers. I wanted to illustrate. I think down the bottom there you can see the target for last year in green, and then the target for this coming year, the year we're currently in blue at the top, and our trajectory in relation to that. So we should be exceeding the target by around about January, and then just above it as we go forward. So I hope that's kind of clear. The uplift target for this year is 1645. So by the time we get to the end of March, we should be at around 1649. But that is something that is, again, subject to a separate meeting now, so that we've got a much greater visibility, and that'll be brought back to our chief officer team meeting on a regular basis as well, so that we can see that we're actually making the progress we need to make in relation to recruitment. Any questions on that one? Okay. And then finally, sickness and absence speaks for itself. I removed the isolation bit from this because it seemed a little bit superfluous, but you can see still, and it will remain the case for a little while yet, that the biggest cause has been coronavirus at 720. And as you can see at the bottom, I think it's a good illustration that actually, as we've gone up through with coronavirus and with cold and flu symptoms, it started to drop again, a slight rise in March, but actually we're now moving back towards more stable levels of sickness that we would expect to see. And that, Commissioner, is it from me, unless there's any questions on that slide.
Jenny.
Thank you.
Hi, not on that slide, but I just wanted to pick up, and I know Caroline's picked up with you separately, Elliot, that we've lost our MYP compliance against the Victims Code.
Yes.
I'd love to see that back in next time, and there's work on going in force. So. Yes,
absolutely. Now, I think we mentioned this at Pam last time. Actually, in 2 months' time, we bring back a much better one. We've got the VSA assessment in June, so there's a huge amount of work currently ongoing around this. So I'll be delighted to bring it back. I think we'll feature it in the slides next time, and it'll show a much better picture.
Fine.
That's it from me.
Yeah, thanks, Elliot. That was really informative again. Thank you very much. So we're just going to go now to agenda item 6, which is questions from the public. And I don't believe we've got any. Simon, can you confirm? Okay, thank you very much. So agenda item 7, any other business? And there isn't any. And agenda item 8, the date of the next meeting, which will be Tuesday, the 23rd of June. Thank you very much for everyone taking part in this meeting, and thank you for watching. Thank you.